Hi everyone, my name is Jackie and I'm here to answer your questions about being a registered nurse. I currently work at UWorld leading our interactive NCLEX study sessions each week, and I have a background in adult oncology nursing. You all sent in so many great questions about what it takes to work in this field, and I'm excited to answer some of those questions for you. So let's get started. What do you love most about your job? This is an easy question to answer. There's nothing better than making someone's day better, whether it's the care you're giving them at the bedside, or the conversations you're having with them, or spending time talking to their family. But just being able to put a smile on someone's face when they're maybe having one of the most challenging days of their life, there's no better feeling than that. And that's really kind of the best part about being a nurse, and what you always have to remember when you have a tough day is that you're really making a difference. And for some of these patients, they'll never forget you, and they'll never forget just the kindness and the care that you offered them. Did you always want to be a nurse? This is a great question too. So I always did want to be a nurse, but I actually took a different career path before becoming a nurse. So I have a degree in finance, and definitely took a U-turn from that and did nonprofit work, and then made another U-turn and went back to school and got my nursing degree. So in doing nonprofit work, I love being able to support people all around the country and in the community I was living in, but just really felt that I wanted to have more of a one-on-one interaction with impact I was making in the world, and so that's what really drew me to nursing. What made you confident that this was the career you wanted to pursue? So I always wanted to be a nurse, but nursing was actually my second career. I had a career before nursing and went back and did an accelerated program. But the reason I did that is because my heart was just tugging me into the field of nursing. I've always been interested in science. I've always been interested in nursing. I have a family history, I guess you could say, of nursing. And when I kind of got to where I wanted to be in my previous career, I just felt like I was meant to be doing something different and something more that was impacting people directly. And so I went back to school and got my nursing degree. But just always I've had a heart for caring for people, and love being challenged by the challenging pace that nursing offers as well. Do you need to have a desire to care for people in order to become a nurse? I would definitely say this is a yes. Caring for people is really the core of what nursing comes down to. You definitely, when you're dealing with somebody that's sick and in a hospital, you're meeting them on probably one of their worst days. So you don't want to be caring for them without kind of a passion for doing it. It's going to show through, and you want to make them feel comfortable. You want to make them feel safe, and that, they're the most important thing to you at that moment. So I would definitely say yes. Nursing is not something that you can kind of do without emotion or without kind of having that heart to care for people. What is your main responsibility in your job? This is a great question. So my main responsibility is to keep my patients safe. Safety is really the name of the game in nursing, especially bedside care. So making sure any orders that are given to a patient, any medications I'm giving, anytime I'm moving a patient, anything like that I'm doing it safely. Safety is most important when you're a nurse. Always thinking ahead too for, what complications might be coming up, using a lot of critical thinking. But all of that really comes down to a foundation of safety. What's your biggest struggle as a nurse? So in oncology nursing, you deal with a lot of end-of-life care, and that can be really hard. It's hard to see all these treatments and investment of time just not do the trick for some of these cancers that these clients are dealing with, and what that impact looks like on these clients' families. And so there's a big emotional component when you do oncology nursing, and I think that's the hardest part, is just knowing that some of these clients aren't going to make it, but in knowing that that there's, you can do the best you can, and really it might not be about what the treatment does for these clients, but how you make them feel in that time you have with them, and making making sure they feel special and cared for and important, and that their voices and their concerns are being heard, and that you're making anything you can kind of take control of in that situation, making those things happen for those patients. So it's definitely a challenging part, but also can be really rewarding, and just knowing that you were able to have a small difference in making someone feel good in some of their last days is definitely a bright side to it. Well, that's all the time we have for questions in this video. Please check out some of our other videos for more information about becoming a nurse. Thanks for watching!